Hi all. Today's lecture is going to focus on the treatment of those who've committed sex crimes. And you'll notice that I've changed sex offenders to those who've committed sex crimes, as this is my area of research expertise. And there's been a big movement in the field, mental health in general. So we no longer refer to people by their disorder. So we don't call people schizophrenics or bipolars. We refer to them as people with schizophrenia or people with bipolar disorders, so that we don't see them as their disease, but rather as human beings who have a problem. So the same thing has now happened in the offending field, starting with sex offenders. And that's largely because there's a tremendous stigma associated with sex offenses. And as you'll learn, the majority of sex offenders don't actually serve that much time in prison, and so they're out in the community and they're subject to a lot of stigmatizing legislation. And so if we start to kind of humanize them, we are hoping that people will see them more as individuals who are trying to rehabilitate as opposed to the crime they've committed, which obviously we will all agree is a very heinous crime and one that is morally repugnant. However, a colleague of mine did research where he had vignettes where one individual was called a sex offender, and in another vignette it was called an individual who'd committed a sex crime, and people were more lenient in sentencing and more supportive of rehabilitation when the word was individual committed of a sex crime versus sex offender. So language does matter. That being said, I'm still, I grew up calling them sex offenders, so I slip back into that language. So what is a sex offense? A sex offense is any sexual behavior with a child, a non-consenting adult, or anyone who's unable to give consent due to physical condition, such as being drunk or intoxicated or high, or mental capacity, having a developmental disability. It includes crimes of penetration with a body part or other object. It includes crimes of contact, like fondling, touching, slapping or grabbing buttocks or breasts, or penis, crimes of non-contact like exhibitionism, so that's flashing. So we'll talk about the contact and non-contact sex offenses a little bit later. And it can also include crimes related to the production and consumption of certain types of pornography, especially child pornography. So even if you've never touched a child, but you're producing or viewing child pornography, you can be considered to be a sex offense, or that's considered a sex offense. So kind of to give you some background, people have become very aware of sex offending, and people are very much repulsed by these crimes and very punitive. And sex offenders have become kind of the most vile types of offenders in our criminal justice system. We're seeing more numbers of sex offenders in prison. There's about 250,000 individuals who are now convicted of sex crimes who are under the care custody of a correctional agency in the U.S. And that number is increasing because of several of the laws. People are now mandated to be on the sex offender registry, in some cases for life. So that number grows exponentially. The majority of those individuals are in the community. So, we talk about, I think that's why rehabilitation is so important, because the majority of people who have committed a sexually based crime are out in the community and not behind bars. And so we want to make sure that they're not committing these crimes again. Right now, only about 5% of the criminals in the criminal justice system are in there for sex crimes. But a lot of people have committed sex crimes, and they're either not identified because people don't report the sex crimes. It's estimated that only about 5% of rape crimes actually the offender goes to jail for a variety of reasons. But also they're called hidden sex offenses, where people there's not enough evidence to convict somebody for a sex crime because it's often he said, she said, or child versus adult, but they've committed some other crimes, so they're bargained down to lesser crimes, so they do serve some time, but they're not labeled a sex offender because they've not been charged with a sex crime. So they think that somewhere between 25 to 30% of the U.S. prison population has committed some sort of a sex crime, but only about 5% of those are actually labeled as sex offenders. So the average sentence right now for somebody who's committed rape is about 10 years. and you're serving anywhere from between 3.5 to 6.5 years for sexual assault or rape. So the length of sentencing has grown, but you kind of think, given the way that we view sex crimes, that we think that they're spending a lot more time in prison, but that's not necessarily the case. Again, highlighting the importance of our rehabilitative efforts, because the majority of these individuals are out in the community. So I think it's important for us to understand who is a sex offender and understand, because in order to treat people's criminogenic needs, we have to understand who are the people that are engaging in these behaviors. And you see all these pictures. These are a cross-section of our society. These individuals are all on the sex offender registry. You can see there are people of all colors, of all ages, of all genders, of all socioeconomic statuses. So there's no distinct profile of sex offenders. So using advanced statistical techniques, we have found there are no specific demographic characteristics that predict who will be a sex offender. And I've been asked that question by lawyers. Does this person meet the profile of a sex offender? And, I can't really say yes or no, because there is no specific profile, because sex offenders can be any age. They can be kids, they can be adolescents, they can be young adults, they can be old adults. They can be any socioeconomic status, they can be rich, they can be poor. They can have any level of intellectual functioning. We have individuals who committed sex crimes who are developmentally delayed, but we also have people who are geniuses who are committing sex crimes. And while the majority of those who we see in the prisons convicted of sex crimes are male, we are seeing more and more females who are being charged and convicted of sex crimes. About 10% of the sex offending population is now female. And actually, it's estimated that that's probably an underestimate, because since females are the primary caregivers and they're still viewed as kind of maternal, a lot of the behaviors that could be construed as sexual offending, or if it was done by a male, females can say, well, I'm doing that in the context of caregiving behavior. In addition, because children are often cared for by a female, they're hesitant to report it. Like, who goes to the doctor with the child oftentimes is the mother. And that's where a lot of these sex crimes are identified. And if the mother's in the room, the child might be less likely to report. So we very much view sex offenders as monsters, but as you just learned, they can be anybody. And you'll get some kind of startling statistics momentarily, but women and children are more frequently assaulted by individuals that are known to them and related to them than strangers. And that's called the stranger danger myth. We believe, like if you think about who is a sex offender, most of you will probably think about the person in the white van who is grabbing people off the street. However, that's not necessarily the case, as we'll learn momentarily. They're a very heterogeneous group, meaning they're very diverse in their racial background, their gender, their sexual orientation, their socioeconomic status, as we've talked about. And generally, these people are ordinary individuals. I mean, you've seen, priests in the Catholic Church, you've seen, coaches, things like that. These are individuals who oftentimes are pillars of our society. And so this is not something that's kind of, written on their face. They don't have lots of, big tattoos or shaved heads or swastikas or things like that. There's nothing that really identifies these people as being sexually deviant. They're coming from all strata of society. We have doctors, lawyers, and most of them are not mentally ill in the sense that they do not have a persistent mental illness such as schizophrenia or bipolar disorder. And the majority of them, this is their first criminal offense. The majority of people who commit, especially child sex crimes, have never been in contact with the law before. So there's really no way that we can identify them. We do, for our research purposes, identify them based on these typologies, and these are based on 4 types of characteristics. And this is related to risk of reoffending, and that can play into how, the level of treatment that we give to individuals. So based on the age of the victim, so somebody who offends against kids under the age of 18 is a child molester versus somebody who offends against people over 18 is a rapist. The gender of the victim, male, female, or if they have both gender victims. There generally is a preference, although we do see crossover, which we'll discuss a little bit later on. There are different levels of coercion that are used to commit the offenses. There are violent and nonviolent. Child molestation tends to use grooming behaviors where you coerce the child through a variety of reasons, but not violence. into committing the sex crimes, whereas in rape, many cases, violence is used or threats. And the type of victim aggression aggressor relationship. So a child molester, somebody who is not related to a child. An incest offender is somebody who offends against somebody who is related to them biologically. A stranger is somebody who does not know the child or the individual. And an acquaintance is somebody that you know, but is not related to you. And so, as I mentioned, the importance for having these kinds of typologies are that different victim types and relationships have different risks for reoffending, and that largely has to do with the sexual deviance of the individual, which I'll explain a little bit later on. Now, the problem with using these typologies is that there is evidence that people are not necessarily discrete in their victim choices. So even though somebody may have a preference for young boys, that doesn't mean they've not committed a sex crime against an adult female. And so again, that goes to play with our, predicting who is going to be a sex offender. It's very hard because about 50%, upwards of 50% of sex crimes, you might see some crossover. Either, they may have both male and female victims. They might molest both children and adults. They might have different relationships with the victims, so it's harder to characterize them. We also characterize individuals based on the type of sex crime. So we have the non-contact sex crimes, which are called the paraphilias according to the DSM-5, which are exhibitionism. That is where you flash. Generally, it's a male flashing his penis to individuals. However, technically, a woman flashing her breasts is also considered exhibitionistic, although females are less likely to come in contact with the criminal justice system because people don't necessarily feel as threatened and won't necessarily report that. Voyeurism is like the peeping Tom. For those of you who ever watched Friends, that here in New York, that would be kind of, taking your telescope and looking in other people's apartments, watching people when they're nude or semi-nude and they don't know that you're watching them. And frauderism is when you rub up against somebody like in the subway, like another non-consenting adult. And we've done some research and we published a study on this, and about a quarter of John Jay students have reported that they've been victimized by a frauder, meaning that somebody has rubbed up their genitals against them, though they didn't want to. So these are called the paraphilias. These are sex crimes, and you can be charged as a sex offender based on these crimes, but these are less. People view these as kind of nuisance sex crimes, although some more recent research that we did and some other people have done have shown that these still do have long-lasting effects on the victims, that we do need to take them more seriously. But the focus of a lot of what we're going to be talking about are the contact sex crimes, which are pedophilia, where you are offending against a child. There are incest offenders, which are family members. We have rapists, which is non-consenting sexual offense against somebody over the age of 18, and a sexual sadist who derives pleasure from torturing somebody else in sexual ways. They derive sexual gratification. So exhibitionism is the most common form of paraphilic behavior. As I mentioned, you're exposing your genitals or entire nude body to a stranger, and that causes the individual to become sexually aroused. They often relive the experience afterwards. They particularly become aroused if the individual kind of reacts strongly, like meaning that they're scared and they run away. Sometimes the individual will masturbate while exposing themselves. They generally don't want sexual contact with the victim. It's really just the reaction and the thought of them exposing themselves. And generally, these individuals don't respond well to treatment. This is a behavior that continues for a long period of time. So there are two general purposes to the behavior. The first is to shock and surprise the victim. And the person may have a fantasy that the person will become sexually aroused. But if a person actually says, oh, and I don't suggest that you do this, but I've heard, anecdotal evidence that if you say, oh yeah, I totally want you, or you kind of chase after the person will actually become scared and run away. So while this is a fantasy, this is not the reality that they seek. We generally see the onset of this behavior before the age of 18. We're seeing fewer arrests in older men, and that's unclear if that's because the behavior decreases or they just become more sophisticated in their methods and are less likely to be caught. In order to be diagnosed with exhibitionism, which is a paraphilia according to the Diagnostic and Statistical Manual, you have to engage in this behavior for at least 6 months. and it has to cause significant clinical distress or impairment to you or other people. So voyeurism, as I mentioned, is the peeping Tom. You're observing unsuspecting individuals that are naked, getting dressed or showering, or engaging in sexual activity. Usually these individuals are strangers, and the person who is engaging in this behavior becomes sexually aroused by watching other people. Again, they do not seek sexual contact with the person. They sometimes have a fantasy of having sexual experiences with the observed person, but again, many times this is not something that they will seek out. And in some extreme forms, this is the only kind of sexual activity the person engages in. Usually starts before the age of 15 and tends to be chronic. Frotteurism, as I mentioned, is touching and rubbing against your genitals against a non-consenting person. Generally takes place in crowded areas so that you can easily escape, such as subways or sidewalks. Can also be considered like grabbing somebody's breast when you're walking in the other direction. We see this mostly in large metropolitan cities, but it does happen in suburbs as well. You'll see somebody like on a bike or a skateboard going the other way from a person, and then they'll, like, as they go by the person, they'll grab their breast or their buttocks. And it usually involves rubbing genitals against the victim's thighs or buttocks, or fondling their genitals, buttocks with their hands. So you might feel something strange in the subway, and that's what that is. So the best course of action when something like that happens, because this is a sex crime, would be to yell out so the person can be apprehended and people around you will help. It can be scary. These individuals generally are not violent individuals. Again, they imagine a relationship, but they need to avoid detection by the victim. So sometimes you just might think that you're in a crowded subway. You might not recognize that this is happening. It usually starts in adolescence, and we see the highest prevalence between the ages of 15 to 25 with a decline after that. So the contact sex offenses are pedophilia, incest offending, rape, sexual sadism, and sexual murder. We won't really talk about the last two because those are so infrequent. While we do see them a lot on, SVU and in the movies, these are very uncommon crimes. Less than 1% of all sexual offending is, sexual sadism or sexual murder. The majority, what we see, is pedophilia, incest, and rape. So pedophilia is sexual activity generally with a prepubescent child, meaning they haven't developed secondary sex characteristics yet. Hebephilia is when a person has specific preference for an adolescent, although that's not a diagnosis in the DSM. There's a lot of debate in the field whether that's a discrete sexual preference, because it's hard to tell, for example, at what psychosexual stage someone is. So there's a lot of debate in the literature about, is this person really attracted to older individuals, or is it something specific about adolescents? The offender has to be older than 16 and the victim generally 13 years or younger. There's usually a 5-year difference between them. Usually those who have a diagnosis of pedophilia have an attraction to children of a certain age or maturity. Again, they have what are called the Tanner stages of sexual development. And so some people prefer children that have no secondary sex characteristics. Some prefer the development, so like breast buds. Other people a little bit older. It can be very specific. So some pedophiles prefer male children, some prefer female children, and some will offend against both male and female. Pedophiles often use persuasion or manipulation to perpetrate their sexual abuse. This is called grooming behavior. You've probably heard about this in the Sandusky case at Penn State. Basically, that's when the pedophile chooses vulnerable children, meaning that the adults either can't care for them, or they're single moms, and they often rely on other people to help them out because they have to work. And so this adult then takes kind of an interest in the child. The child likes to have the attention from this adult. They do a lot of fun things together. The mother or the parent, the guardian, trusts their child with this individual, and slowly they start doing things together like tickling. They're desensitizing to the touch. And then oftentimes they'll watch pornography, and then they'll start to touch children. And, sometimes they'll say, don't tell your mother. They start having secrets. And eventually that leads to the child abuse. And at this point, the child feels like they've somehow contributed, and there's remorse and shame, and they don't feel like they can report because people will blame them. So these are very sophisticated offenders in the sense that they know how to get the children to acquiesce. Pedophiles often convince themselves that the child wants to be involved with a sexual relationship with them, um, and that their involvement with the child will meet their adult emotional needs. They usually don't want to hurt the child, and they want to believe that the child is enjoying the experience. Often the child will become physically aroused during the abuse, and that also confuses the child because it's, just touching the genitals can cause um, an erection. And so they're very confused. They're like saying, if I'm enjoying this, then I must want this in some way. And that also reinforces to the pedophile that the child wants to be there. They're not necessarily running out. And the child often returns because they have been groomed. And so this is kind of further evidence to the sex offender that they wanted to be there. They often project thoughts and feelings they want the child to have about them onto the child. So they tell the child, you love me, you want to touch me, things like that. And they interpret the child's positive responses to grooming and manipulation of acceptance of the behavior. And they convince themselves that the behavior is not hurtful or damaging. And that's where the cognitive distortions come in. And this is where the child molester doesn't recognize that this is something that is really damaging the child. So incest is sexual contact among blood relatives. It also includes people who are in quasi-parental authority. So it could be a stepfather who does not have a blood relationship but is acting as a parent. That is also considered incest offending. It's very widespread, and it's thought to affect about 1/10 of families. So the behavior falls in a continuum from inappropriate sexual talk to exhibitionism, sodomy, and rape. It generally happens more than once over a period for several years, and it's not uncommon for incest offenders to offend against several members of the same family. So what would happen would be, they'd start offending against the oldest daughter. When the daughter hits puberty and starts menstruating, they would move on, and when she can risk getting pregnant, they move on to the next child further down the line. You see the most common contact between a father-daughter or stepfather-stepdaughter. And the majority of victims of incest offending are female children. They generally take place in families where there are high rates of both physical and sexual abuse. You're seeing, because of the mother has some sort of, oftentimes the mother is vulnerable, either because she abuses substances, she has mental illness, and so the young children assume caretaking responsibilities at an early age. There's a lot of substance abuse in the house, and there's estrangement between the parents. And so in those cases, the male doesn't have a very good relationship with the adult female. And so while they're technically defined as pedophiles, their main sexual attraction is adult women, and their victims, which are their daughters or stepdaughters, are often surrogates or substitutes for adult females. So they technically are attracted to adult males or females, but because their partner, they're not satisfied with them, they then start abusing the young girl in the family. So the victim often assumes the partner role, meeting both physical and emotional needs of the perpetrator. And this allows the offender to distort their beliefs that the victim is an age-appropriate sexual offender. And you'll often see them denying or minimizing their offenses because of these cognitive distortions. So rape is defined as forced sexual intercourse without consent. It's associated with very aggressive, though not necessarily physically violent behavior on the perpetrator. Generally, it's by a man against a woman, but we now know that it can be by a woman against a man, as well as same-sex relationships. So you often see threats, use of hostility, physical force, and intimidation to overpower the victim. There's often threats that are involved to minor children so that the victim can acquiesce. And while they may use physical force or weapons, they often use threats and intimidation to coerce the victim into sexual activity. Many times rape does not result in physical injury, which makes the prosecution much harder. It's easier when somebody is battered and bruised, but that's not the majority of rape cases. If you think about, cases of date rape, there's often, not a lot of things that you see on the person in terms of their physicality, and therefore it's harder to prosecute because the perpetrator will say she wanted it, she was with me, we were on a date, and when there's no physical abuse, it's harder to prosecute. The victims are often viewed by rapists as weak and easily dominated. Many times they don't care about the emotions of their victims, or they misinterpret them. Their primary interests are self-gratification, dominance, and control. So you'll see a lot of the same characteristics of the IPV offenders that we talked about. They'll often engage in penetration or specific sexual acts, like having the victim engage in fellatio, but you don't necessarily see the high level of fondling that is common with child molestation. We often see with rapists that they have deviant sexual arousal and higher levels of impulsivity. Rapists actually meet a lot more of the same characteristics of violent offenders than child molesters. So, while we group these guys all in the same category as those who've committed sexual offenses, qualitatively and quantitatively, they have actually different profiles, with rapists looking a lot more like violent offenders. And oftentimes there's a lot of crossover with rapists having more extensive criminal histories and more violence in their history, not necessarily sexual violence. Rapists often have a significant amount of cognitive distortions about women. They're generally more angry and prone to emotional outbursts. Rapists generally have a history of abuse and chronic problems, and they're often repeat offenders with various criminal behaviors. So as you see, these individuals are more criminalized than our child molesters. So why do people commit sex crimes? And that's really important in treatment, because we want to know what their criminogenic needs are. And the problem is that we really don't know. Some hypotheses are kind of the misuse of sex, that there's been some pairing of deviant sexual behavior and arousal somewhere in their childhood, that they've been rejected by adults and therefore they feel more compassion towards children and more belonging, that they've observed people treating women like objects and that's how they're viewed in society, that they have, they're born that way with a sexual attraction to children. Some people argue that it's a sexual orientation. I am not arguing that, but that, that these individuals are born sexually attracted to children. They experience social discomfort with other adults and feel more comfortable around children. They lack empathy and they have a history of abuse themselves. What we do see with sex offenders or those who've committed sexual crimes is that they do have higher levels of abuse, both physical and sexual and emotional, than the average individual. However, it's estimated that about 1 in 4 girls and about 1 in, I think, 9 boys will have been a victim of sexual abuse. And the majority of those individuals do not go on to abuse other people. So while that may contribute to sexual offending behavior, it is not sufficient. And we can never say that that causes somebody to engage in sexual offending. So we talked about recidivism. What might surprise you is that sex offenders have the lowest recidivism rates of all the offenders that we're going to be talking about. A large study, only 5% were rearrested for new sex crimes over a 3-year period. One meta-analysis where they did an average of 5 to 6 year follow-up found that 13% of sex offenders reoffended sexually, meaning they committed another sex crime. 36% completed, 36% had another crime, but it wasn't necessarily a sex crime. It could be a probation violation or something like that. However, if you look at other types of offenders, like burglars, for example, 75% of them will reoffend over a 5 to 6 year period. Another study found that with a 5-year follow-up, 24% committed a new sexual offense. So, while 25% is not nothing, it's still not 100%, which is probably what most of you were thinking before now. Now, the important thing to think about is that only 5% of sex crimes are committed by somebody who could be on the sex offender registry at the time of their offense, which means that 95% of individuals were not identified as sex offenders before. So we're spending a lot of money with these sex offender laws, which we'll talk about momentarily, and we're only targeting about 5% of the sex crimes that are committed. So when we talked about recidivism rates based on offender type, here are the 5, 10-year, and 15-year recidivism rates. So those people who molested only boys have the highest rate of sexual recidivism because they're thought to have the most deviant sexual arousal. So 5 years, it was 23%, 10 years, 28%, 15 years, 35%. Those who molested girls, those are our incest offenders, we're seeing 9, 13, and 16. The reason for the lower molestation of girls is those are incest offenders, and once identified by family, they're not left near children again. And so and also those who committed incest, as you see, 6, 9, and 13%. So these are very low. So what's really important in terms of treating those who committed sexual crimes is doing a very good risk assessment. And that's looking at variables that contribute to sexually deviant behavior, as sexual deviance has been considered to be one of the best predictors of sexual recidivism. So there are a variety of things, including victim type and number of past crimes, which are known to be predictive of future reoffending, and those are the static factors. There are also dynamic factors such as emotional dysregulation, substance abuse, that are related to sexual offending behavior, and those are evaluated with a sonar. So sex offenders vary in their response to treatment, and a lot of that is based on their risk level. And so it's important for us to constantly evaluate risk, because we want to make sure that no children are ever or adults are violated again sexually. So we have general risk assessments that kind of talk about like psychopathology and or general assessments, but we also have sex offender specific assessments that look at factors that we know that are related to sexual recidivism, and those are the static 99, the VRS, the violence risk scale sex offender version, and the sonar, which is the sex offender needs assessment risk scale, which is the dynamic measure. And so we need to be able to evaluate them both to determine their risk for reoffending, but also their needs in treatment. One thing is unique to sex offenders is called phallometric assessment. And we use what's called a penile plethysmograph, or for women, you can evaluate vaginal swelling, although we don't usually use it with women. But basically, we know that those offenders who have deviant sexual arousal, meaning that because they are attracted to only children or violence, that they're more likely to reoffend. And so what happens is, you can see these are transducers that are placed on the penis. I didn't put there's actually an image in Google Images if you look up penile plethysmograph of what this looks like on a person, but I didn't want to be accused of showing you pictures of nudity, so you can do that on your own. But they put this on the penis, they show the individual pictures, kind of something like in the left-hand corner of children and women in different levels of sexual development, and you can see these are not actual pictures of children, but the faces are digitally altered. You can also do it with audio stimuli. There's a lot of debate about the quality and the nature of the stimuli. But we were able with phallometric assessment to differentiate pedophiles from non-pedophiles, rapists from non-rapists, those who engage in higher levels of violence. So we can also, among rapists, sexual and violent recidivism are well predicted by phallometrically measured interest in non-sexual violence. So those who are attracted to violence are more likely to engage in future recidivism. And so a lot of people will undergo phallometric assessment. It has to be done by a trained phallometrician. So not everybody has access to this type of risk assessment tool. However, there are some big drawbacks. About 12% of individuals don't respond correctly because their levels of sexual arousal are too low to accurately classify them. People can inhibit their deviant arousal by thinking about something else even while they're viewing the stimuli. And there's been some research suggesting that people can fake good, just like the polygraph. So now moving on to treatments, we have the medical biological treatments. So these are particularly salient for those who have that deviant sexual arousal, and that's what drives them, which is not the majority of sexual offenders, but it is a significant minority of them. There are 3 medical interventions: surgical castration, where the testicles are removed, anti-androgen or hormonal treatments, and psychosurgery, where they remove the frontal, or they target the frontal lobes or the limbic system. The latter being very unethical, so that's not really performed anymore. It was something historically that people were doing. And even surgical castration is very rare. Sometimes offenders will request that. But what we do is we do prescribe anti-androgen treatments, and in some cases it's mandated. But in one meta-analysis conducted in 1995, the hormonal treatments were among the most effective in reducing sexual offending. In terms of different types of models of sex offender treatment, most of these take place within the criminal justice system. You can also see it in outpatient clinics because some people are mandated to engage in treatment, and in private clinics as well. It's typically done in group format, and the main models follow either the R&R model, relapse prevention model, and more we're seeing the Good Lives model being instituted with sex offending. So some of the things that we're targeting with all these interventions are cognitive distortions, deficits in intimacy and social functioning, problems with emotion regulation, so handling like negative emotions like anger, but also things like sadness and depression, because we see that's often correlated. So when people feel vulnerable, they're more likely to reoffend. We also target victim awareness and empathy, although there's little data to support that this is important in sex offender treatment, although I think, we feel better of making sure that people have empathy for their victims. For those for whom it's relevant, there are treatments that are behaviorally based for deviant sexual arousal, the anti-androgen treatments. And then we talk about self-management or relapse prevention, so high-risk situations, how do people manage themselves out in the community? There's still a lot of debate about the treatment of sex offending. We know that with Martinson that nothing works, but we've since kind of debunked that, as we now know. Many of the earlier studies of sex offending treatment didn't adhere to the R&R model. So one meta-analysis in 2002 of 43 sex offender treatment outcome studies found that those who completed treatment had a 12% recidivism rate. Those who did not had a 16% recidivism rate. So while not astronomical, 4% is definitely something when you think about the victims involved. When they looked at only CBT-based treatments, those who completed had a 10% sexual recidivism rate, and those who didn't complete had 17%. So now we're seeing bigger changes. So when you did another study looked at hazard rates, so the risk of reoffending, so those who completed CBT-based treatment decreased their risk for sexual recidivism by 20%, violent recidivism by 18%, and general recidivism by 12%. And the most recent rigorous meta-analysis of well-controlled studies, meaning they had some sort of control group, found that 10% of people who were treated recidivated and 13% of untreated people recidivated sexually. So again, we're looking at about 3.5% difference, but that's still something. The only study that's been done to date that really has strong results is MST, which we're going to talk about next lecture when we talk about juvenile offending, but it really significantly cuts the risk of sexual reoffending. The last thing I want to touch on today is if any of you ever work with those who've committed sex crimes, those who are released are going to be facing a lot of sex offender laws. The Jacob Wetterling Act, which then turned into Megan's Law, which requires everybody, as you can see here on the top right, to be on the sex offender registry. If you're a moderate or high risk sex offender, that is now a national law called the Sex Offender Registration Notification Act, SORNA, which was passed by George W. Bush. There are also residency restrictions. These are done by municipalities, which do not allow sex offenders to live or loiter within a certain distance from where children can congregate. Some people will have GPS monitoring, as you can see in the bottom left. And for those highest risk sex offenders, there's post-sentence civil commitment, where after they've served their criminal sentence, they are then sent to a civil commitment facility for additional treatment, and they're not released until they're deemed safe. So basically, when we look at the effectiveness of sex offender registration, or sex offender laws, they're very expensive, and there's really not a lot of evidence to suggest they work. So one study, we did a study recently where we looked at those sex offenders who were civilly committed, and we estimated that of those who were civilly committed, about 18% would have recidivated in the community, but that means that 80% of them are being locked up indefinitely, and they would not have, reoffended if they were in the community. Residence restrictions, meaning that they can't live or loiter within a certain distance from child-dense areas, are not effective at reducing recidivism, as most people, because they're not strangers, meet their victims in places that are not defined by residence restrictions, so in homes of children. So only 7% in the study that we did found kids in areas, their victims in areas that would have been defined under residence restriction. And those who did recidivate were randomly located, and they don't reside in child dense areas. The reason that I tell you about this is because of the collateral consequences. So basically, we found that not only are these laws not effective in reducing recidivism, but they might actually increase the level of recidivism, because as these sex offenders you saw have not so long sentences, they're being released back in the community. And so, you can imagine if you are now in the sex offender registry, everybody now knows you're a sex offender. You also cannot live in many places. And so you're living, in the middle of nowhere. And therefore, this can increase. If you've ever seen the movie The Woodsman with Kevin Bacon, it kind of demonstrates kind of some of these collateral consequences. But there is research to show, and we've done some of that research, that not only are the families of these individuals affected, but they are infected themselves. And it is highly possible that these laws actually increase their likelihood for recidivating sexually, because many times they cannot find adequate housing. They are now homeless, transient.